Bismillah ar-Rahman ar-Rahim. This time I will speak about the student assessment domain for accreditation. طيب عندما تجينا اللجنة ممكن تسألنا what methods of assessment do you use and how do you decide the pass, fail mark, cutoff mark, and do you use grade boundaries for each level for excellent or A, very good, or B, and so on and so forth. طيب, what methods of assessment do we use? We use a method of assessment according to the pyramid of learning. وبالتالي احنا we ask ourselves يعني do we want to test for just memory or recall memory, or we want to test for understanding and comprehension, or we want to test for applying or analyzing data, or evaluating data, or evaluating a problem, or creating something in practicals. Accordingly, for the amount of knowledge and type of knowledge, we use to put the questions either in best of 5 multiple choice questions or modified essay questions, or to put the thing in problems or in practical problems in the dissection room to identify things, or to do things in the laboratories, or to examine patients and solve problems in the clinical studies. So it depends, the method depends on the pyramid of learning. And how do we decide the pass-fail cutoff mark? We use the norm referencing in most of the subjects. In surgery now we are adopting modified Angoff method as a criteria referencing. Hoping in the future we will continue with criteria referencing. And do we use grade boundaries? Yes, we use grade boundaries, and we are going to discuss this in the coming slides. What tools of assessment do we use? We said we have formative evaluation, and then we have summative evaluation. And in the summative evaluation, we have mid-course examination, and mid-course examination itself is composed of several items, and the final course assessment is also composed of different items. And are we guided by a blueprint? Yes, we are guided by a blueprint, and in the blueprint we have, for example, in the continuous assessment, we have a mid-course assessment. We give it about 10% of the marks, of the total marks. And we have assignments, we have seminars, log books like this. We give them 5% of the marks in the continuous assessment. And in the summative final assessment, we have paper 1 and paper 2, that is the best of 5 multiple choice questions, and the modified essay questions. Total, both of them, they took about 40% of the marks, and the practical OSPI, OSCE, OSLR, or PACES receives about 40% of the marks, and total will be 100%. And how we assess knowledge, skills, and behavior according to each type, the knowledge or skills, it is category for assessment tool. And for each of these, we have, of course, evidences from the examination in all courses in the faculty. Now, the relationship between assessment and learning. How do we choose the assessment method compatible with intended educational outcomes? We described this before. If it is something theoretical, according to the learning pyramid, whether we wanted just a cognitive knowledge for recall memory or understanding and comprehension, or applying or analyzing, evaluating, and creating things. And how does the assessment system promote student learning? Of course, in the formative evaluations, the students have feedback from the tutors, and during the whole study period, they have continuous feedback from students, and the teachers, they have also feedback, and there are special forms for evaluating the learning process. Now, how do we guide academic progress? We guide the academic progress by the formative evaluation. And are your assessment methods open to scrutiny by external experts? Yes, we adopt the system of external examiner in all final examinations to increase the validity of the examination. And also we use external examiners from other faculties of medicine, Ministry of Health, and Sudanese Medical Specialization Board. As a quality standard, they may ask, how do you assess your assessment system? And we have to provide an evidence. To assess the assessment system, for example, in the multiple choice questions, to assess the multiple choice questions, we do item analysis, the discrimination index and the difficulty index, like that. And the external examiners in the final examinations also, we have their opinions verbally and written. Now, as a quality standard, they may ask, and do you assess the integrated learning, and how? Yes, we provide the students with seminars, and we evaluate the seminars in which there are integrated problems, and we give integrated problems in the modified essay questions in exams. And do you use assessment feedback to the students? If yes, how? Yes. In the formative evaluation and in the mid-course evaluation, usually the tutors give feedback to the students. Now about the admission policy. What is your admission policy? There is an admission policy written that can be provided as an evidence. We just decide the number, and when the students are accepted, they attend an interview committee in which they were sent for physical fitness in the university clinic, and they study also their social status to decide the fees for education. And do you have a student transfer policy? Yes, there is a student transfer policy, but it is rarely implemented because of the high number of students in the faculty. And so there are just meager chances for accepting transferred students. And no places, no seats. And do you have a policy for credit transfer? No, until now we didn't adopt it, and it is something to be studied in the future. What is the relationship between mission policy and admission and the desired quality of graduates? Yes, when the students are accepted in the university, they attend an interview in which they were informed about the policies of the faculty and the ways they are going to study and to be assessed. and they continue with the system to implement the mission for the mission of the faculty to get a well-qualified graduates. And do you have appeal policy for revision of examination marks? Yes. Usually there is a policy written, and the student can have a written application to the head department, which will be forwarded to the dean, faculty, and to the university academic affairs. The student have to pay the fees, and a committee will be assigned to remark his papers. The decisions they get will be given to the students and will be fixed to his files and sent to the university academic affairs. Now, how do you graduate the admission? Do you regulate the admission capacity according to the number of seats in the faculty? And student counseling and support. There is a written policy, and it is applied, and we have an office for student counseling and support, supervision and support. And this office has a written policy, and it is well applied for social, financial, medical, and academic support. And we encourage the students to attend career guidance workshops. And the students are well represented in all faculty committees, particularly the committee of the curriculum committee. And they attend some of the faculty board meetings. And how do you encourage activities of students, organizations, and exchange programs? Yes, there are two types of budgets in the faculty budget for the student support and for enhancing the student learning and exchange programs, and they are well regulated and supervised by the GEMICs. Also for assessment, to increase the validity, we have external examiners from inside Sudan, and we had in 2009 external examiners from Saudi Arabia for all the final major subjects in medicine, surgery, obs and gynae, and pediatrics. And why do we use grant point aggregates? Because it is internationally recognized between universities and by employers, and also it reflects the overall level of student achievements throughout the study. And it is more judicial to compare between students in the whole period of the study. And here we just give an example for the newcomer teachers, that in the blueprint, the continuous assessment is 20%, while the summative assessment is 80%. Continuous assessment is composed of mid-course examination 10%, seminars 5%, assignment 5%, maybe also logbooks and these things, and summative assessment is 40%. The written part, paper 1 and paper 2, 40%, and the practical OSPI, OSCE, or OSLR, 40%. For the grant point aggregate, we transfer the standards, the marks that the student get to letters A, B plus B, C plus C, and we change these to points for 3.5, 2.5, and 2. And then to calculate the grant point aggregate, we multiply the points the student obtained in all examinations, in each examination by its credit hours, divided by the total number of credit hours. And here are the range for each letter A between 80 to 100, and C between 50 to 59. And in between, we get the achievement, whether it's excellent, very good, good, pass, or fail. Thank you very much. To see you in the next talk about accreditation.